Does the PAP test screen for high-risk HPV? Imagine a test that helps catch cervical cancer early, but does it actually test for the virus that causes most cases? The answer is a bit more nuanced than a simple yes or no. The PAP test, also called a PAP smear, is designed to look at cells taken from the cervix under a microscope. Its main goal is to find abnormal cells that could turn into cancer if left untreated. It does not directly detect the presence of high-risk human papillomavirus, or hrHPV, which is the main cause of most cervical cancers. Instead, it looks for changes in cervical cells that might have been caused by an infection with high-risk HPV types. These abnormal cells can be signs that the virus has been active and may lead to cancer over time. To find out if someone has a high-risk HPV infection, doctors use a different test called an hrHPV DNA test. This test looks for the genetic material of the virus itself. It is more sensitive in detecting women who are at higher risk because persistent infection with high-risk HPV types is the key factor in developing cervical cancer. In clinical practice, there are two main ways to screen for cervical cancer. One is using the PAP test alone, which detects abnormal cells but does not identify the virus directly. The other is co-testing, which combines the PAP test with an hrHPV test. This approach looks for both abnormal cells and the presence of high-risk HPV. Research shows that hrHPV testing alone or combined with the PAP test is more effective at catching precancerous changes early. It has a higher sensitivity for detecting cervical intraepithelial neoplasia, grade 2 or worse, which are the precancerous lesions that need treatment. When both tests are negative, women can often wait longer between screenings, which is convenient and safe. So, to clarify, the PAP test itself does not screen for high-risk HPV directly. Instead, it finds cellular abnormalities that might be caused by the virus. The hrHPV test is a separate molecular test that detects the virus itself. Using both together provides the best chance of early detection and prevention of cervical cancer. This distinction is important because understanding the roles of each test helps women and healthcare providers make informed decisions about screening. Regular screening with the appropriate methods, guided by medical advice, is the best way to reduce the risk of developing cervical cancer, which is closely linked to high-risk HPV infections. Always consult your healthcare provider to determine the most suitable screening plan based on your age, health history, and risk factors.